Hello, everyone. Thank you so much for joining. We are going to give it just a couple minutes for folks to log on. Thank you again for being here. Hi, everyone. Thanks so much for joining. We are going to give it just another minute or two for folks to log on, and then we'll go ahead and get started. Thanks, everyone, so much for joining. We are going to give it just a few more seconds since the participant list is still ticking up, and then we will get started. All right, let's go ahead and jump on in. Hello, everyone. Thank you so much for joining today. I'm Kim Johnson, Policy Manager with the National Low Income Housing Coalition, and it's my pleasure to welcome you to our Housed Campaign National Call for Universal, Stable, Affordable Housing. So as usual, we have a very exciting call coming up for you. We will hear about new research on the connection between historic redlining and heart health. We're going to get an overview of findings from HUD's AHAR Part 2, and hear updates from the field. But first, we're going to mix things up a little bit with a policy update. We wanted to share just some information on where things are now with Congress in recess and highlight our updated congressional recess toolkit that advocates can use to take meetings with their members throughout the month of August in order to weigh in on the importance of increased funding for HUD affordable housing and homelessness programs. So if I could have the next slide, please, May. Oh, and allow me to introduce as well my colleague, Brooke Shiverite, who is our field manager. Brooke, are you on? There you are.
Hi, everyone. Great to be here.
And so Brooke and I are going to be covering our policy update and talking about our August recess toolkit. So first, let's talk a little bit about where things are. So as we've covered on this call before, we have seen both the House and Senate FY24 THUD spending bills come out. And so that's the funding bill, of course, for the federal transportation, housing, and urban development funding bills. Overall, in the House, HUD received funding at a level of $68.2 billion, which is a roughly 10% increase from FY23. That bill does propose some deep cuts or the elimination of a few HUD programs, but does also provide for slight increases to HUD's homeless assistance grants account and funding to renew most rental assistance contracts. Since that bill was released, however, our colleagues at the Center on Budget and Policy Priorities have been crunching the numbers, and it looks like as of now, the increases to rental assistance in the House's proposal may not be sufficient to cover all voucher renewals. In contrast, we also got a spending bill out of the Senate, and that bill provides HUD funding at $70.06 billion in the upcoming fiscal year, which is about a 13% increase from the previous fiscal year. The Senate bill proposes funding for the tenant-based rental and project-based rental assistance programs that would be expected to renew all existing contracts and provides additional funding for the homeless assistance grants program. There would be a few funding cuts under the Senate draft, including public housing capital funds. There would also be a few programs that would receive level funding, but overall the Senate bill, as expected, is definitely the high watermark in this year's appropriations negotiations. We are also hearing that members of the House Freedom Caucus, which for a reminder is the far right contingency of the House GOP, are pushing for even steeper cuts. Essentially, when the debt ceiling agreement was reached and said that the House and Senate would agree to hold funding roughly level in FY24, House Republicans turned around and said, that is not good enough. We want to see funding levels cut to FY22. Some House appropriators did a little bit of kind of, I guess, I don't want to say magic math because the magic is resending a lot of funding from other programs, but they did some a little bit of a magic math in order to make the numbers for HUD programs work, or almost work rather. But again, GOP leaders in the Freedom Caucus are saying that is not good enough and insisting on rolling back funding even further in any final bill. That of course contrasts the Senate bill, where appropriations leaders Patty Murray of Washington and Susan Collins of Maine are instead pushing for a supplemental funding measure to add more assistance to all of those vital defense and non-defense programs that would otherwise see some funding cuts under that budget deal. So next slide, please, May. Thank you. So our priorities for FY24 are relatively simple. It's just no cuts. Don't cut the funding to affordable housing and homelessness programs. Fully fund tenant-based and project-based rental assistance programs to renew all existing contracts and ensure that nobody who relies on that assistance loses their housing. Full fund for public housing operations and repairs. Full funding for HUD's Homeless Assistance Grants Program to continue addressing the needs of people experiencing homelessness. We're still pushing for funding for legal assistance to prevent evictions and maintained funding for the competitive tribal housing program targeted to tribes with the greatest needs. Next slide, please. And so where we are now, Congress is adjourned for August recess, and members are going to be back in their home states and districts until September. Now, contrary to popular belief, recess is something of a misnomer. The congressional recess is for members of Congress to go back to their home states and districts and meet with their constituents, hold things like town halls in order to hear from their constituents what they need. This is also a great opportunity for advocates to take meetings with their members of Congress. You don't have to wait for your members to set something up. You can contact them. And coming up, because of those discrepancies that we covered between the House and Senate bills, we're anticipating a real showdown in Congress come September when members are back. Congress only has until September 30th to pass all 12 of their appropriations bills, to pass a continuing resolution to keep the government funded, or they will be in a government shutdown. And I should note here that many members are already anticipating at least a brief government shutdown come October 1st. So now I'm going to turn it over to my colleague Brooke to talk about our updated congressional recess toolkit and all of the wonderful information that it has on how advocates can take action during this August recess. Brooke, please go right ahead.
Thanks, Kim. Thanks for that really helpful overview of our policy asks and where we're at right now. And good afternoon, everyone. It's really great to see so many of you on the call today. My name is Brooke Shipwright, and I'm the manager of field organizing here at NLIHC. Like Kim outlined, the challenges ahead are pretty great, but they are not immovable. So thanks to advocates like you, during the pandemic, we saw governments at all levels respond with unprecedented resources and protections to keep people housed. And most recently, like Kim was talking about, we saw some cuts, but not the level that we were anticipating in the initial stages of the federal budget process. Again, this is thanks to you all's advocacy. But like Kim said, we're not quite in the clear yet. We all need to continue contacting our members of Congress to ensure these critical programs are funded to the highest level possible in the final bill, and to hold Congress accountable to do its job and work together to pass a budget on time, as well as other key policies that would further housing justice. So luckily, our new advocacy toolkit and other resources make this easy. Like Kim said, August recess is when members of Congress go back home to their districts and states and attend community events, hear from constituents. So now is a really great time to start planning how you'll participate. On page 2 of the toolkit, pictured here, we list some possible activities to consider. So for example, if you're a tenant or part of a resident association, you might consider inviting members of Congress to your building or community center to discuss what an affordable home means to you and why they should prioritize this in the federal budget. Or maybe you're a homeless service provider or property manager of affordable homes. You could similarly invite your members of Congress to tour your program or building and meet constituents to highlight how affordable housing and homelessness resources are positively impacting their constituents and why more is needed. Or maybe you'd rather go directly to your members of Congress. You can schedule a meeting with them and their staff in their local offices and may want to consider bringing key stakeholders along to educate members of Congress and their staff about the affordable housing crisis in your community and the federal policy solutions that Kim touched on. For any of these types of events and more, you can use our toolkit meeting request template and planning tips, our storytelling resource to share your personal story related to affordable housing, and sample social media messages to amplify your message and thank your members for meeting with you. The toolkit's also a great resource for talking points and data you can use when talking to your members of Congress about these priorities. So definitely check it out and be sure to get in touch with us, your NLIHC organizer that covers your state, with any questions you might have. Next slide, please, May. Another resource available to you is our Legislative Action Center on our website, which can be used year-round to contact your members of Congress directly. Look up your members of Congress if you don't know who they are, and add your organization to our various sign-on letters. That's at nlihc.org/take-action, take-action. We know what it takes to end homelessness and housing poverty, and we hope you'll join us this August recess and beyond in building the political will and congressional support to do it. And lastly, much of our work is made possible by our individual and organizational members, and I invite those of you who aren't currently members to join today. You can do so at nlihc.org/membership. And with that, I'll turn it back to Kim.
Awesome. Thank you so much, Brooke. So I do not see any questions in the chat, but please do feel free to pop those in and we'll be happy to respond. But it is my pleasure to introduce our next speakers, Dr. Salil Dio, who is from the Louis Stokes Cleveland VA Medical Center, and Dr. Sadir Al-Kindi, who is from the Houston Methodist DeBakey Heart and Vascular Health Center. They are going to be talking about new research that they've conducted linking historically redlined communities to heart and cardiovascular health. So doctors, thank you so much for joining.
Thank you so much for having us. And can you hear me well?
Yep, we can hear you great.
Fantastic. So I will be speaking on behalf of my colleague, Dr. Salil Dio, and the entire team of physician scientists who were able to kind of produce some of this data and help us with the analyses. So our talk today will be about historical redlining and contemporary cardiovascular health. This is a collaboration between multiple institutions, as you can see, but there are more that are not listed on this slide. Both of us have no disclosures to report as it relates to this research. So as you may know, redlining is an unethical practice, puts services, especially financial and otherwise, out of reach for residents of certain areas. This practice started in the 1930s, where there was a recession and there was a limitation on mortgages. And at the time, the Housing Homeowner Loan Association and Corporation, they came up with maps that covered about 250 cities throughout the United States. And they basically colored these maps. As you can see, this is a true kind of digitization of one of these original maps that shows you the colors that these were labeled. And basically green is the best. And then you have a red that is redlined, and or these people who are denied mortgages for housing. And then you have the yellow, which is second to redlined, and then you have the blue, which is basically a little worse than green, but not as good as the green. And these basically were maps that are generated based on, a lot of them were generated based on racial composition of individuals that reside in these areas. So it was a very racist kind of policy. Of course, it got outlawed by the Fair Housing and so on and so forth. But we as clinicians, we were interested in understanding whether this policy had left a long-lasting legacy of health outcomes. So one of the initial studies that we performed is we really wanted to understand, there has been a lot of literature or emerging literature suggesting that historical redlined areas have a variety of different diseases, including increased risk for asthma, respiratory disease, kidney disease, and things like that. There was a gap in understanding cardiovascular health outcomes in individuals, especially given that it's the leading cause of death, morbidity, and mortality throughout the world. So one of the initial studies that we performed was to look cross-sectionally at the United States, where we looked at these maps that were recovered and digitized, and we looked at 11,000 neighborhoods, so to speak, or census tracts. And these, we hypothesized that there is decades of disinvestments. This redlining practice led to disinvestments, which led to increased in environmental adverse exposures, air pollution and whatnot, socioeconomic stressors, racial segregation and discrimination, lack of access to care, and unhealthy lifestyles as a result, to name a few. And then what we did is we linked these with the neighborhoods, and we tried to understand, and these are the colors here, as you can see, hazardous or red line. The best is the green, and then you have blue and yellow. And we wanted to understand the risk of cardiovascular disease and cardiovascular disease risk factors. So for example, diabetes, obesity, and things like that. So what we found was not really surprising, but it kind of cements and adds to the emerging literature. When we look at the prevalence of diabetes, it really significantly increases from the green or historically green neighborhoods to historically redlined neighborhoods. And the degree of this association was very strong. So if you go from 9% to 14%, and that's approximately 50% relative increase in the prevalence of diabetes. And the same thing applies to smoking, obesity, and high blood pressure. So across the board, you see a significant linear relationship between the risk of, or the category that is assigned by the HOLC at the time with the present day cardiovascular prevalence of heart disease. So because the risk factors are high, then it's not surprising that coronary artery disease, which is the main cause of death and morbidity in the United States, is also increased across the board. Same thing with stroke, and same thing with chronic kidney disease, which is something that has not been shown before. So we wanted to kind of look at this geographically, and at the time I was in Cleveland, so this is Lake Erie, this is Northeast Ohio, and kind of greater Cleveland area. And if you look at the HOLC grades, these are the original colors. These are red, green, blue, and yellow. If you look at the prevalence of coronary disease, the map of prevalence of stroke, and map of prevalence of chronic kidney disease from the CDC, you can see that these maps are superimposable. They're almost exactly the same map. So this is important to realize that these have long-lasting impact and legacy on current health risk factors and health outcomes, even approximately a century after it was outlawed and with the Fair Housing Act. So we wanted to move and kind of study this in patients. All of this analysis that I showed you thus far is just looking at geographic areas, but we wanted to study, is there an association between this HOLC classification or redlining categorization on health outcomes in patients who have pre-existing disease, including heart disease or kidney disease. So the first study we took was to look at the veterans who are the most vulnerable patients, but they have improved access to care, at least in terms of coverage, insurance coverage and things like that. So we nationally looked at all the veterans who have at least one of the cardiovascular diseases at baseline. And what we wanted to see is, in these patients, do patients who reside in historically redlined neighborhoods have higher risk of developing heart attacks, strokes, or dying from heart disease? So we basically, when you start to look at HOLC grade A, B, C, D, you see that there is a, as the HOLC grade increases, there is a higher percentage of having Black individuals or Black patients in this cohort, having marginalized Hispanic communities as well. And then there is also an increased risk of smoking, increased prevalence of chronic kidney disease, heart failure, diabetes, and so on and so forth. And then when you start to adjust for things and look at what are the risks for downstream, you can see that veterans who are residing in redlined or historically redlined neighborhoods have continued to have 13% risk for having heart attacks, strokes, and dying from heart disease. So this was even after adjusting for age, sex, race, and ethnicity. We also wanted to look at another cohort of individuals who are having a chronic kidney disease. As you know, chronic kidney disease is a major risk factor for having heart attacks, strokes, and congestive heart failure. And in this complicated table here, we looked at a study of patients who are enrolled in a cohort study that's funded by the National Institute of Health called CRIC. And what we found is in patients who have chronic kidney disease, residing in historically redlined areas had threefold increase in risk of heart failure or dying from heart disease, which is tremendous. This is something that we, as clinicians, when we see patients who come to us in clinic, we don't think about where they live. We don't think about whether they had been, having intergenerational racism and exposed to systemic segregation and things like that. So this is important because now we can characterize this in the clinic and we can start to think about ways to mitigate that risk. Not only in kind of chronic heart disease things, but what we found is this is another study that we performed where we looked at a big registry, national registry of patients who had cardiac arrest. This is, people who have their heart stopped. And the standard of care right now is to do CPR or chest compressions. And, we're trying to educate the nation about the importance of doing CPR as timely as possible. What we found in this study, where we identified about 100,000 patients who had cardiac arrests that reside in one of the categorized areas by HOLC, we found that after adjusting for a variety of different things, patients who reside or who had cardiac arrest in areas that have historically redlined had 22% less likely to receive a bystander CPR. This is CPR that's performed by an individual who's not a medical personnel, just the bystanders. And this is important because this can lead to further segregation and worsening of cardiovascular outcomes and increased mortality and things like that when people don't receive timely CPR, especially by bystanders. So we, as part of this, especially as it relates to cardiovascular disease and cardiometabolic disease and chronic kidney disease, we hypothesized as part of this work is that, having a historically redlined neighborhood led to significant disinvestments and led to things that impacted the environment of these locations and neighborhoods. So, for example, it was cheaper to put a highway or a freeway through the red line neighborhoods as compared to a green line neighborhoods. So that led to, for example, increased pollution. Maybe the infrastructure is kind of poorer infrastructure for clean water and things like that. So we just wanted to look at the characterization of the environment throughout the nation and throughout the United States and look at historically redlined neighborhoods specifically and see if they have if that proves our hypothesis true. So what we looked nationally at all the neighborhoods throughout the United States, more than 11,000 neighborhoods. And we characterized the spectrum of environmental hazards. And this is proximity to traffic, wastewater, proximity to air toxics or kind of air pollution, both from a respiratory standpoint and from a cancer risk, diesel particulate matter, which is a type of air pollutant as well. And you can see here proximity to national priority sites, proximity to waste facilities, hazardous waste facilities, and underground storage. And we color-coded these, as you can see, by the redlining kind of characteristics. And you see across the board with probably one exception. You see across the board that red line neighborhoods have worse environment. So they have higher proximity to traffic and have higher air pollution levels, have higher diesel pollution and things like that. Also, we looked at kind of things that are non-traditionally thought about in the environment. So green space, having access to parks and green space and greenery, noise pollution that's resulting from traffic noise, and light pollution, which is light at night. And you can see that across the board, the environment is worse in red line neighborhoods. So for example, red line neighborhoods have lower access to green space. They have higher access to or higher exposure to noise, traffic-related noise, and light pollution as well. And all of these have been traditionally linked in other studies with cardiovascular outcomes. So it's no surprise that when your environment is poor, your cardiovascular risk is higher. Not only that, we wanted to look at all of the studies that I showed you thus far have been kind of just looking at one time point, just the most updated result, most contemporary result. We wanted to see as a nation, have we been doing better over time in terms of looking at the exposure? So we looked at, compared kind of HOLC-B, HOLC-D, which is the redlining, and HOLC-C, which is kind of orange line, so to speak, or yellow line. And you can see over the years from 2005 till 2020, and in this analysis from the early 80s, the difference in NO2 concentration, which is basically a traffic-related air pollution, and PM2.5, which is a more comprehensive air pollution, has been really stable in these years, and it goes between about 15% increase comparing the red line compared with the green line to about 5% here in PM2.5. So as a nation, we haven't been able to close the gap, although air pollution levels, for example, have been coming down and improving nationally. It remains, the red line neighborhoods remain at a disparity when it comes to cardiovascular outcomes and when it comes to air pollution, and we're not improving that much. So in summary, these HLC maps that were created in the 30s led to significant disinvestments in marginalized or minoritized communities and continue to have impact on current day health outcomes, specifically cardiovascular outcomes, but in the broader areas of non-communicable outcomes as well. In the United States, historically, red line neighborhoods continue to have significantly worse cardiovascular risk factors, as we showed you today and hopefully convinced you, and cardiometabolic disease, including coronary disease, stroke, and chronic kidney disease. And this leads to significant difference in life expectancy, significant differences in survival, and so on and so forth throughout the nation. At the individual level, even when you see patients that come to us in clinic, residing in red line neighborhoods is associated with significantly worse outcomes, and especially in patients with pre-existing coronary cardiovascular disease and patients with pre-existing kidney disease. And this offers opportunities for intensive preventive strategies and focusing on also proximate determinants of health as it relates to the environment and the neighborhood. As I showed you in our preliminary analysis, cardiac arrests that occur in red line neighborhoods are less likely to receive bystander CPR or chest compressions. And this really, the highlights of this is we have opportunities to improve CPR education, either in school or public forums, especially to improve cardiovascular outcomes in cardiac arrests. And then historically, red line neighborhoods continue to have significantly worse environmental exposures, and we have not, as a nation, we have not been able to close the gap in terms of the disparities in environmental pollution, air pollution over the past 3-4 decades. So I thank you so much, and I welcome any questions. These are our contact details. Please email us if you have questions or concerns, or if you want to talk a little bit more about research or anything of that nature.
Wow, thank you so much, Dr. Al-Kindi, for joining, and to you and your team for this really groundbreaking research. One thing that I was wondering as you were talking is there are there any kind of long-term solutions or policy solutions that you and your team were kind of thinking about as you were doing this research?
Yeah, no, that's an excellent question, and I think it's always there is always research to highlight and raise awareness, but what is the solution? And I think one of the areas that really have significant evidence these days is affordable housing, right? And there's actually a very interesting study that was published a few years ago by the HUD. It was basically a randomized trial where they took women and children who live in poverty, and they gave them either vouchers to move out of the poverty or high poverty neighborhoods, or give them vouchers and remain in the high poverty neighborhoods, or give them nothing. And it turns out that if you give vouchers, housing vouchers, and people actually end up moving to a better preserved neighborhood, better outcomes, and so on and so forth. These people who are in this study was women and children. They have less diabetes, and they have less obesity when it comes down to 5 years to 10 years down the road of that. So just things like that can really impact. And I think there is a lot to be gained from that experiment that was funded by the HUD. But there are other opportunities. And one of the opportunities for us right now, which we're exploring, is can we incorporate some of this information, at least at the clinician side, as simple clinicians? What can we do about that? One is, can we incorporate some of this information about historical residential areas into prediction of risk so that we can perhaps control cholesterol better? Maybe we can, bring it to the awareness of the physicians that these individuals remain at higher risk, and maybe we should control their blood pressure better. Maybe we control cholesterol better. But there is also other things that we're involved in and leading in Cleveland is a study to look at utilization of non-physician-led interventions in the community, and basically screening and intervening on social determinants of health by community health workers, linking individuals who sometimes have available resources at the county level, at the city level, at the federal level, but they just don't know how to access these, including food banks and things like that. And of course, the broad ultimate thing is really changing policies to have cleaner air, better resources, and thinking about, the long-lasting impact of anything that we do with these maps, right? Now there is gentrification, there's other things that are happening, and we have to think, this is not just a simple line that is drawn on a map, but it may actually lead to significant intergenerational health outcomes that can really, really be, detrimental to the population.
Wow, yeah. So something that you said that really sticks out and reminded me of NLHC has a campaign called the Opportunity Starts at Home campaign that really looks at the intersection of housing and, like you were saying, Dr. Al-Kindi, all of the other intersections of health and, economic mobility and stability. And we really lean heavily on that research from HUD and Raj Chetty, I believe, as kind of foundational to that idea of where somebody lives determines so much about their health outcomes and their economic outcomes and all of those other pieces that are so deeply connected to housing. And I think your research just really drives home just the literal physical impact that living in a redline community can have, and the importance, of course, of policies that will undo those historic wrongs, those racist decisions that were made to ensure that people of color, Black people especially, ended up in these redlined districts with poorer health outcomes and all of the other impacts that lead from that.
Absolutely. I totally agree with you. And I think it's important to say that some of these impacts have been direct because we cannot explain them by just smoking. We cannot explain them by increased diabetes. So there are things that are still understudied. And this is really our focus has been as a research group, is to unmask and understand, because that's how you decide what to intervene on. So there is smoking, increase in prevalence, then maybe campaigns and taxing and things like that, policies. But that's part of the equation, not the entire equation. And I think we have to start somewhere. And I think your team's work has been really influential in terms of affordable housing. I think is number one in my opinion as a major risk factor.
Well, thank you so much for that. And there, just one more question, and then we're gonna let you go. So we had a question in the chat about the intersection or how housing affordability really plays into this, the impact of redlining. And I was wondering if you could just talk a little bit about how, unaffordable housing in neighborhoods of opportunity really perpetuates the cycle of low-income people being exposed to these environmental hazards.
Yeah, absolutely. And I think in this research, we really have not kind of looked at this quantitatively, but I can tell you from a practicing clinician, I'm a preventative cardiologist. So my job is to kind of, prevent cardiovascular disease and drive people who into better health in general. And I think, no matter what medications or, the best out of the best cutting edge medications and devices and things that we do, if an individual cannot afford housing, right, this really has a significant impact and toll on their health. And not just because of, the obvious, right, I cannot afford this and stuff, but it actually has a significant toll and impact on their stress level. So there's a biologic thing that goes on that really increases stress level, and that perpetuates into kind of worsening cardiovascular outcomes and so on and so forth. But that can be applied really to any health outcome. So I think, and the study that I just mentioned to you about the HUD study where they looked into this really provides a level A or level 1 kind of evidence to say that intervening on housing affordability by just providing vouchers, that can have a significant, tangible, measurable kind of metric that can really be impactful, both from cost saving, from burden on the environment, burden on the individuals, burden on really everything. So I think we do need better and bigger solutions, because healthcare is going into a vicious cycle right now, increasing costs and so on and so forth. But ultimately, I think we need better solutions, political solutions, public policy solutions that really can identify the primordial or the proximate determinants of health even before people get risk factors. And that's really where the neighborhood that interventions that we need are important.
I also want to add that when we talk about housing, I think it is like an anchor. So, these are chronic conditions like diabetes, hypertension. So they need continuous treatment. They need regular follow-up visits to the primary care provider, change in medications, titration of medications. And if someone does not have stable housing, then all these downstream benefits of that are lost. So they won't be able to collect medications on time. They don't have a permanent address where they can receive mails from their primary care provider or hospital healthcare system. And so it becomes like a domino effect where one thing really perpetuates the disadvantage of others.
Thank you both so much for sharing your insights, or sharing your research, and for all of the excellent work that you're doing. We'll look forward to what you do next. And until then, thank you again so much for joining us. Really appreciate you taking the time.
Thank you.
Thank you. Thank you.
Thank you. All right. And so we are going to turn now to my colleague, Elena Calabro, who is a senior policy analyst here at the National Low Income Housing Coalition, to provide a quick overview of findings from HUD's Annual Homelessness Assessment Report, Part 2, which I think is going to be a really nice complement to the research that the doctors just presented. So Elena, I'll turn it on over to you.
Sounds good. Thanks, Kim. Hi, everybody. Nice to be here with you today. So as Kim mentioned, I'm here to talk about the 2021 Annual Homelessness Assessment Report, or AHAR Part 2, that HUD released last week. The AHAR Part 2 is an annual estimate of the number of people experiencing homelessness in the country, with a focus on sheltered homelessness. The 2021 Part 1 report, which is also known as the point-in-time estimates of homelessness, was published in February 2022, and that provided a single night estimate of people experiencing homelessness in both sheltered and unsheltered settings at the state, local, and national levels. So the Part 2 report, which is what I'll talk about today, draws from local data collected by Homeless Services to provide a national estimate of people who utilize shelter programs at some point from October 1st, 2020 through September 30th, 2021. And what's different about this year's report is that it provides the first full year of data on homelessness since the COVID-19 pandemic. Next slide, please. So between October 2020 and September 2021, which the report covers, sheltered homelessness overall decreased by nearly 17%. At least 1.2 million people experienced sheltered homelessness in 2021, compared to about 1.4 million people in 2019. The data show that family sheltered homelessness decreased by 25% since 2019, and the number of people in adult-only households experiencing sheltered homelessness dropped 13%. The number of unaccompanied youth in shelters also decreased, dropping 24% from 2019. And also between 2019 and 2021, the number of veterans experiencing homelessness dropped by 18%. This really marks a continuation of the decline in veteran homelessness that predated the pandemic. As we've discussed before, the Housing First model, which is used by the VA and its two largest homelessness programs, has really been instrumental in reducing veteran homelessness by more than 50% over the last decade. Next slide, please. So the 2021 AHAR Part 2 also demonstrates the persistence of racial and ethnic disparities, as well as a growing cohort of older adults among people experiencing homelessness. Black, Indigenous, and people of color continue to be overrepresented among people experiencing homelessness due to structural racism that exists across all of our systems. While Black or African Americans represent just 13% of the overall US population, they represent 39% of people experiencing sheltered homelessness. And the data also show that more older people are experiencing sheltered homelessness. Nearly 10,000 more people aged 65 and older experienced sheltered homelessness in 2021 than in 2019. And the number of older adults experiencing chronic homelessness increased by 73% over that same 2-year period. Next slide. So the data show that the inflow into the homelessness services systems dropped for both adult-only households and families with children in 2021. Compared with 2019, nearly 20% fewer households accessing shelter were doing so for the first time. But in contrast, the numbers and shares of people entering shelter programs from other experiences of homelessness increased by 11%. And in the report, HUD notes that the eviction moratoria, emergency rental assistance, and other pandemic resources likely, helped reduce the flow of families into shelters. And they also note that the data reflect really concerted efforts by the homelessness services systems to engage people staying in encampments and other unsheltered locations and help them move into non-congregate shelters. This resulted in a sheltered population composed of fewer households experiencing homelessness for the first time and more people with chronic patterns of homelessness. And on that note, between 2019 and 2021, the number of people experiencing sheltered chronic homelessness increased by 32%. So HUD points out that it's an interesting factoid. One of the strongest indications of the impact of COVID-19 eviction moratoria and other homelessness prevention programs is the decrease in the number of adult-only households whose prior living situation was rental housing that they paid for without using subsidies. In fact, 35% fewer households entered shelters from these situations in 2021 than in 2019. In addition to the influx of federal resources, which really played a role in this, HUD also notes that reduced congregate shelter capacity, as well as safety concerns given the pandemic, also could have kept people out of shelters and resulted in these decreases that we see in the data. And as for potential factors impacting the increases, the report points to the economic impacts of the pandemic, as well as notes that the shortage of affordable housing definitely made it more difficult to transition people from the experience of homelessness into rapid rehousing and permanent supportive housing, which makes sense as what we know about the shortage of housing. Next slide, please. Yeah, so as I mentioned, there's a lot of data in this report. I'm only providing a very quick snapshot of some of the findings. I'll mention a few top line takeaways with the caveat that there will be conversations diving deeper into what the data mean in the coming weeks and months. So first, I just wanted to point out a quote from HUD Secretary Marcia Fudge, which she states in the opening of the report, that the data really demonstrate the inextricable relationship between homelessness and housing instability. We saw that the historic resources and protections enacted by the government during the pandemic, including the federal eviction moratorium and $46.5 billion in emergency rental assistance, really helped prevent a catastrophic increase in evictions and a spike in homelessness. And we do see this reflected in the data on sheltered homelessness. And we also know that these vital resources were never meant to address the underlying causes of homelessness and housing instability, which are the severe shortage of homes that are affordable and available to people with the lowest incomes, as well as the widening gap between incomes and housing costs. We also saw that as these never before seen resources were depleted and these protections were phased out, renters were facing skyrocketing rents and inflation, increased costs for food, gas, and other necessities. So what we're seeing now is that people with the lowest incomes are struggling more than ever. Eviction filings have surpassed pre-pandemic levels, and as a result, homelessness is increasing in many communities. So I'm sure I'm not saying anything that you all don't know, but without continued significant action from Congress, we know that the affordable housing and homelessness crises will only continue to worsen. So really we must take what we learned during the pandemic and what is evidenced in this new report, which is that we can prevent and reduce homelessness when we provide significant resources and protections that keep people with the lowest incomes in their home, people with the lowest incomes, help them obtain and maintain their housing. So truly to end homelessness, Congress needs to provide those significant long-term investments needed to bring the solutions that we know work to scale. So next slide, please. This final slide just includes links to the 2021 AHAR reports. And I also just wanted to put a plug in for the next national NLIHC, National Alliance to End Homelessness, and Center on Budget and Policy Priorities joint webinar on homelessness and housing first. That's taking place on August 14th at 2:30. And we really hope you will join. And that's it from me.
Thank you so much, Elena, for sharing all of that. And I also wanted to drop a link to register for that excellent webinar in the chat as well. Sorry, I lost my links that I had pulled up. Okay, here we go. And so folks would be welcome to join. Oh, thank you so much, Elena, for dropping that. And I also do notice that there is some inappropriate comments in the chats going on, and we are working on removing the user who is responsible. So yes, thank you to folks who have flagged that for us. And thank you, Elena, for this really important summary of this research. One thing I did want to ask, so I guess we're not necessarily surprised by the results of this AHAR, but one thing that we did find really interesting is that, these reductions in the number of people experiencing homelessness have really been linked to, or at least coincided with, those increased investments from the pandemic around affordable housing and homelessness assistance and vouchers. And so I would love to just kind of hear your thoughts on what is the connection there and what is kind of the bigger picture that we should take away from those findings.
Yeah, for sure. You're absolutely right that it did coincide with these decreases in sheltered homelessness, and really shows that when we do make these investments, we can make a difference and we can get people housed and help them stay housed. And so in terms of looking at the bigger picture, I think a major takeaway is just that, like, we know what works and that we need to bring those efforts to scale. We had never seen these unprecedented resources and protections provided. And so it really just drives home the need for these priorities that we've been pushing, which is, to expand and preserve the supply of affordable housing, to establish a permanent emergency rental assistance program. We saw how that worked so incredibly well, to make rental assistance universally available, as well as to implement those robust tenant protections that have been lacking, but can really make a difference in helping tenants. So I think that's the major takeaway, is seeing the success of these resources and the need to continue them and fund them at the scale needed, really.
Absolutely. Thank you so much, Elena. And I don't see any other questions in the chat. So we are going to keep it moving right along. And we're going to move on now to our field updates. First from Kim McCarthy, who is Executive Director of the Community Alliance of Tenants in Oregon. Kim, thank you so much for joining.
Absolutely. Thank you so much for having me here. I'm just going to give you an overview of what our community has been working on in Oregon, and then give you some of the specifics of how that's playing out as a policy. And so let me first start with why we started this work, and it's very much along the lines of what you've been hearing here. What's happening in Oregon is no different than what's happening nationally. We saw in the last couple of years an extreme spike in the cost of housing. And because we already had in place a provision to cap the cost of housing, we thought that provision that we put in place in 2019 would be sufficient, but no one had anticipated an increase in housing for our community, which was 14.6%. So that increase was based on a formula that we had already put in place to cap housing prices, and that was the Consumer Price Index, a base of 7%. So when the Consumer Price Index went over 8% last year, that's when we realized that our landlord communities could start increasing rents to as high as 14.6% for that body of housing that was protected, which was only housing that was older than 15 years old. And then for housing that was newer than that, there were no protections. So we saw communities getting 30% rent increases, 50% rent increases. And as you can imagine, the rate of evictions directly tied to the affordability of housing, and these rent increases spiked. So right now our rate of evictions is comparable, if not surpassing the pre-COVID numbers. And our visible homelessness in our community is also off the scale. And with the recent homelessness count, we can see that we have widespread homelessness, and it's not just in our urban areas, it's in every community in the state. And so when this COVID money came to our community, we made some really important investments in homelessness prevention, shelter, et cetera. And with the loss of that funding, we're seeing all of those investments dry up very rapidly. Our smaller communities are not able to maintain that type of service, even though it's well established that it was effective. The emergency rental assistance was effective. The shelter support was effective, both as a public health measure and as a measure to prevent homelessness and all of the other very serious issues that result from homelessness. So in this coming year, COVID was over. Many of the supports were gone. The rent cap provisions that we had put in place were not working. So what did we do about it? We brought together a coalition called Stable Homes for Oregon Families, a number of housing advocates throughout the state. It was a group of 30-some organizations. And we recognized that there just wasn't one solution that we needed a package of solutions. We needed rent assistance. Was well proven in the public health emergency that rent assistance was working. So we needed to continue that practice. We needed eviction reform, the eviction moratoriums, making sure that there was more time between when an eviction was posted and when someone went to court. All of those measures that we had taken during the public health emergency had worked really well, and we needed them as being the norm for our eviction processes. Reasonable rent limits. Like I just pointed out that we had established a rent cap, but it wasn't working. So we needed something that was even more reasonable. And then we also needed information about the rental market. Who are the landlords? You know, how can somebody who has an issue get in contact with them? There are just so many things that we just don't even know about our rental market. And we thought that we could do that through rental registration and more education of landlords about fair housing practices. So we embarked upon those efforts. What we were successful in doing was securing about $80 million in emergency rental assistance for the coming 2 years. We were successful in making sure that housing was considered a priority. And so our governor put a lot of political capital into making sure that there was money for homelessness prevention, money for shelter. So that was also very significant. Many of the eviction reforms that had taken place during the public health emergency were put back in place. So the most significant one was that historically in Oregon, a renter is only given about 3 days of notice after their eviction notice. And now it's 10 days of notice. So that has been really significant in terms of giving our service providers that might have rent assistance time to connect with that household, time to connect with the landlord. And it has prevented a lot of evictions. It's prevented a lot of homelessness, just having that extra time. And then reasonable rent limits. In the 11th hour of our legislative session, we did pass a more reasonable rent limit. So now what it is it's the base of 7%. So for buildings still older than 15 years old, the landlord can increase the rent to a base of 7%. Plus the consumer price index, but there's a cap of 10%. So it'll never go over 10%. And we already know that that is a tried and true process. It has not damaged our landlord community in terms of their profitability. It's been in place in the Portland metro area, which is our largest metro area in terms of population and tenant population. So it was a very reasonable provision. And then lastly, historically, we've always, with the original rent cap bill, there was a provision that if there was an eviction for no cause, the landlord needs to repair the roof, or they're moving in a family member, what have you. For the larger properties, that particular tenant would get relocation assistance. And again, that has been well proven in the Portland metro area. And so now that is in effect going statewide. So we're really pleased with the results. Of course, we think it could have been much better. We know that a rent increase of 10% for a low-income person who is not getting an increase in their wages still can result in an eviction, and it's still happening. But we're hopeful that this will be an important first step.
Wow, thank you so much, Kim. What incredible work you all are doing. And I'm just really struck too by the fact that you noted how helpful and how effective so many of these resources were, and that so many of them have just been allowed to expire, even though they're effective, even though they're helpful. And so I really deeply appreciate the work that you and your colleagues at Community Alliance of Tenants are doing in order to ensure that those resources stay in place and to ensure that people can have that housing stability in the long term too. I don't see any questions in the chat. Oh, one that just came in from Gina. Would love to hear more about the 10% language and how the negotiations went down in those last hours. The landlord dynamic and or conservative, was there a weird or an interesting landlord dynamic or any conservative lawmaker pushback?
Yeah, first let me say that the coalition Stable Homes for Oregon Families included unions. It included legal aid advocates like Legal Aid Services of Oregon, Oregon Law Center, to name a few. And that's what I think made us effective. And then we had some really amazing legislative champions. What was really odd this year was that at the same time, we were also, I guess as a community, we were also working on issues related to healthcare, and access, regardless of your gender identity, access to language services, and as a result, there was a body of legislators that left and refused to vote on anything. And so for almost 2 months, the Oregon legislature was in complete standstill. Nothing was passing. There was even fear that the budget would not pass and that we would have to do a continuance. So while this was not the most important issue because we had already compromised tremendously, we wanted a 3% cap, as we had seen in other communities in this nation, and was more in keeping with how wages might increase for a low-income household. And in the end, we were all held hostage by this particular political dynamic that happened in Oregon.
Thank you. And a great question from Sarah in the chat. Have you thought of trying to help other states through this process, or sharing the components your organization worked through in detail to help other areas where there is a lot of resistance to rental assistance and caps?
Yeah, I'd like to, point out that this is a cap. And so the argument here is that when a tenant comes into a contract with a landlord, there's an expectation that there isn't going to be rent gouging, that they should be able to expect that for a year, that their rent will be what they agreed to when they signed that agreement, and that for the years to come, it will increase at a reasonable rate. So I think that argument was persuasive. Of course, it's really important to share this information. That's why I'm here today. That's why I listen to others. We were very influenced by the work that's happening in Boston, that's happening in Minnesota, in California. So it's definitely important that we all share our experiences, because this is a national issue.
Absolutely. And we love to see those good policy changes rolling through all of the different states as we continue to fight on the federal level as well. Thank you so much, Kim. Oh, maybe another question. Thank you so much, Kim, for joining. Really appreciate you and all of the work that you and your crew are doing. And we'll have to have you back on too to give us a little bit more of an in-depth overview so we can get some of those tips of how to do this in other communities as well.
Absolutely. Thank you so much.
Thank you. And next, for our final field update today, we are going to turn to Tiara Labrada, who is Associate Director of Advocacy and Outreach at the Supportive Housing Network of New York. Tiara, welcome. Tiara, you're with us? I actually don't see her on. Oh gosh. Well, we will reach out to her, and while we're circling back to see if she is able to join or if maybe she got kicked out, I did want to put in a plug, a reminder for folks that today is the last day to submit comments in support of federal renter protections for the FHFA. It is also the last day for organizations to join NLIHC's sign-on letter for the FHFA to provide increased protections, including things like anti-rent gouging protections, just cause evictions, and other vital protections that would be make a real difference for housing stability for people living in FHFA-backed properties. I'm going to give another call out to Tiara to see if she is on. And if not, we might have to circle back and invite her to a future call because she has really cool slides that I was really excited to hear more about. Oh, a great question from Sarah in the chat. Do you have a link to where we can make those comments? Absolutely. So we have a few links and a few resources to share that are related to that tenant comment for FHFA. So here we have a portal from our colleagues at PolicyLink and a few others who have been doing this work with us. Tenantcomment.org is a portal that folks can submit their comment to FHFA through. We also have a sample letter that folks can use to help kind of write their own comment to FHFA and tell them about their experiences and the need for increased renter protections. Yeah, and so I think that we are going to have to circle back to get Tiara on our next call. But thank you all so much for joining. And I am going to leave it there, I guess. So thank you all so much for joining. We are going to be following up on Friday in our Friday article or our Friday newsletter called The Connection. We have a summary of today's call along with all of the links and resources that we discussed today. We'll also have a recording and slides from today. So this is certainly not the end, and we will be back in a couple weeks with our next call. Thank you all. Oh, sorry, just another comment since we have time in the chat from Anna. Is there an alternate way to share if we're not in the position to do so with the comments due today? Unfortunately, the comments are due by midnight tonight. It might be easier for folks to join onto our sign-on letter, to visit our Take Action page where you can weigh in with members of Congress about the need for additional tenant protections. But unfortunately, that FHFA comment does close tonight. That is outside of our control. But yes, we are going to close it up. Oh dear, so Tiara's Wi-Fi went out, unfortunately, so that is enough. Thank you all so much for joining. And we will be back in a couple weeks. Take good care in the meantime, and we'll see you soon. Bye.